I think it's something just to get out in the open and talk about and say that criminalizing is not the solution. You give women incentives or families incentives to say, you have this baby and we guarantee you that that child will have a decent place to live, will have education. I think just the solution is prevention as much as possible, and that certainly means we need sexual education, education on birth control, and those kinds of things. Well, before Roe versus Wade, when they were still illegal, I was 37 when our youngest was born, and we wanted even another one after that. But a friend of mine said, well, now, Betty, if you don't want the baby, there's a really nice place in Kansas City. You go for the weekend and you pay $2,000, and it's just like in a nice hotel. And my jaw kind of dropped, and I said, well, we want the child, but I thought that was evidently kind of common knowledge that if you could afford it, and you decided you had enough children, then you could go to those places. But after Roe versus Wade, like I say, this from a health standpoint, I think that women felt much freer and more, gave them more control themselves. I think that my main point is that all through, and not just in this country, but in other countries, they knew that way back when women took potions when they thought that a pregnancy would ruin their life. Because when I was in nurses training, I was assigned to a patient that came in with a fever of 105, and she told me that her married boyfriend had taken her to and paid for, because there was a house in Beaverdale where someone did abortions to help a girl in trouble. A girl in trouble could go there for an abortion. And that would have been, well, it would have had to have been between 1946 and 49. Well, personally, if I had to make a personal decision, I can't imagine that I would make one for an abortion. But I sure would not judge anyone in any way, shape, or form, knowing how desperate some of them have been to try such a thing.